So continue to look ahead. There's been recently talk about biomarkers from the blood. So what are the prospects for that, Brad?
Well, I think we've seen the field truly revolutionized with biomarkers of amyloid and tau in the spinal fluid or measured through PET scans. I think the holy grail is that there would be at least a sensitive, if not specific, blood test that could help us triage the patients that we spend a lot of money getting PET scans on or ask to do an invasive procedure like a spinal fluid examination. So I think we've seen more reports recently of progress on very sensitive assays to detecting both forms of amyloid and forms of tau in the blood. And so I think most biologists that are working in this area and neurologists that are also neuroscientists doing this work are optimistic that it won't be too long before we have a blood test that may not be the final answer, but will help us decide whether we need to move forward with the more expensive or invasive tests that we have available now. So I hope that it won't just be that. I think we'll be seeing some progress in genetic factors that can be measured increasingly easily from blood that would allow us to identify these so-called polygenic risk scores that enable us to look at the multi-genetic loading that people may have that either make them more likely to develop Alzheimer's or more likely to develop one of the other forms of neurodegenerative disease. And again, that's probably a risk stratification type of test that will I think be available at some point in the future. And so those are some of the things in the blood. I think we'll see new spinal fluid biomarkers that enable us to both measure the neurodegenerative progression of these diseases and potentially have other markers for readouts in clinical trials, and maybe even prognosticate better with regard to these other processes like neuroinflammation that are potentially exacerbating the condition. And of course, new PET scans that will enable us to measure frontotemporal lobar degeneration pathology markers or Lewy body pathology markers. And then I think the other thing that doesn't get talked about as much in terms of the future of biomarkers is measures of circuit function and dysfunction. We often think about FDG PET or functional MRI, but there's an increasing effort to develop more accessible tools with electrophysiology in particular that might allow us to measure in a more accessible way the functioning of brain systems, more in a way that's more sophisticated than conventional EEG that's used clinically. And I think that will potentially relate to some of the efforts to develop treatments targeting circuits that may be what you would consider to be neuromodulation or neurostimulation technologies that I think are coming along as exciting as we've seen them become efficacious in the field of major depressive disorder. I think we're hoping that they might actually be tools that would be part of our treatment strategies of the future in some of these neurodegenerative diseases, especially in the early stages.
Right. Yeah, I'm very excited too. For the next, I think, 2, 3, 5 years, we're going to have blood tests that are going to really help us detect some of these things and get people to the attention that they need, and including going into studies and clinical trials. So actually, I want to ask you, Mark, if people want to turn to clinical trials, they want to learn about it, where should they go?
We need more people participating in clinical trials. That's the bottom line. Obviously, clinicaltrials.gov is a good clearinghouse, but I think for the average caregiver or patient, it can be overwhelming. The Alzheimer's disease has a trial match entity, which is very helpful, and that's a good way to get started. There's always advertisements locally people can find because there's so many trials going on. But I think going through an organization such as the Alzheimer's Association is sometimes the best, because anything registered with that is going to be a well-vetted trial. And people need to know that there should never be a cost to be part of a trial. They need to understand the role of placebos and that they have full rights throughout the trial. That education is key to get more people involved in those different really critically important trials.